able to provide education for cardiac rehab to demonstrate exercises to patients in the comfort and safety of their own home during COVID.
So one of the biggest advantages is that we've been able to provide services to children and their families. The children aren't coming in and risking either contracting or spreading COVID.
And they came during, the middle of the early COVID outbreak when everybody was reluctant to go into public spaces. And so it was nice to know that the appointment would continue. It was simple, no travel, right? Like we're a busy household. The kids are 6-year-old twins, lots to do to pack people up and get them into doctor's appointments.
Sometimes the technology doesn't work, and sometimes families aren't very technologically savvy, or they don't have access to consistent internet connectivity. So one of the other disadvantages is the uptime that it's taken for clinicians who don't necessarily have a lot of experience with technology.
When patients do not have access to internet, so that was definitely a challenge for us. And also helping patients getting set up with the virtual platform during the startup phase was a bit challenging. Lots of phone calls helping people, but for the most part it was pretty good.
For the benefits, I find it to be convenient, especially in this time of COVID.
Making services as accessible to clients as we possibly can.
There's no transport, there's less stress on the patient having to be transported. But to me, the significant knowledge transfer that occurs is something that's very special using virtual care.
So it is kind of nice to be able to do therapy in a place that is comfortable to me.